Good morning. This morning we'll speak about the COVID-19 situation in Canada and P.E.I, a little bit on the vaccine rollout, of course the Atlantic bubble, and some easing of long-term care, visitation, as well as rotational workers and of course the Easter Bunny. I know each week I end my briefing with that sort of mantra or suggestion that we be patient and kind to ourselves and to others. And this week I feel it's timely and that I need to begin my comments with a reminder that now more than ever we need to be patient and understanding. I recognize that the past 13 months have not been easy. Individuals, families, businesses, and communities have all been through a great deal. And while we have managed everything that COVID-19 has presented to us, it has not been without its challenges. And COVID-19 has taken a toll on every islander. And there have been highs and lows, and we've gone through extended periods with no cases, and we have managed outbreaks of COVID-19. We've had circuit breakers and yet enjoyed life in the new normal phase. The pandemic has been compared to a marathon, recognizing that it is a long journey and not a sprint. And while we are on the home stretch of this race, the next few months will not be easy. Runners often say the last part of the marathon is the hardest and challenging of one's endurance. So being patient and understanding, respectful and considerate will help us all cope better in the weeks and months to come. Many provinces are now struggling with a third wave of COVID-19, with increases in cases, hospitalizations, and ICU admissions. The increasing incidence of variants of concern is very worrisome. This reality is balanced with many positive signs that will give us hope and optimism as we manage the last leg of our marathon. We have access to effective vaccines and a plan to immunize all eligible islanders as quickly as we can, with a single dose by the end of June and 2 doses by the fall. Islanders are stepping up and are eager to be immunized. We have proven measures in place to continue to limit importation of COVID-19 into our province, and Islanders have demonstrated their genuine willingness to follow public health measures. Also, we are anticipating the reestablishment of the Atlantic bubble in April. There are 3 new cases of COVID-19 to report today. The new cases are all close contacts of a previously reported case. 2 of the cases are young people under the age of 19 and 1 in their 40s. These individuals will remain in self-isolation for another 14 days and will be followed daily by public health. We currently have 14 active cases and 159 cases since the pandemic began. There are approximately 94 close contacts in self-isolation. In Canada, there have been over 971,000 cases and 22,900 deaths since the pandemic began. Canada is expected to surpass the grim milestone of recording 1 million cases of COVID-19 later this week. Currently, there are over 45,000 active cases in the country. The number of reported cases in Canada are up for the 3rd consecutive week. This week, cases are up 24%. The current Canadian daily rolling average number of new cases, 3,800, is 8 times higher than it was last summer, where it was 400 cases. The variants of concern continue to surge across Canada. Estimated to be 40 to 50% more transmissible, the variants are steepening the curve associated with the 3rd wave. The variants of concern are a new and unpredictable variable that will impact the trajectory of the 3rd wave. Compared to previous waves, the burden of disease is shifting to younger people, especially those aged 20 to 39. And the big question about the curve for the 3rd wave is how high will the numbers go? Amid increasing case counts, shifting severity of disease trends, and an increased proportion of cases associated with variants of concern, we do need to remain vigilant. Maintaining public health measures and individual precautions remain important factors to reduce infection rates, limit spread of the variants, and prevent a reacceleration of the epidemic. As vaccine programs roll out, public health measures will be eased very slowly and will be balanced with increased testing and screening to detect variants of concern. As measures are eased, we will maintain sufficient capacity to conduct contact tracing and provide isolation supports. As of Saturday, 21,712 doses of vaccine were administered to Islanders, and that includes 6,406 second doses. In accordance with recommendations from the National Advisory Committee on Immunization, P.E.I. will pause the use of AstraZeneca vaccine in adults under the age of 55, given the safety signal of the vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT, in Europe. There have not been any cases of VIPIT in Canada. Given we have an adequate supply of mRNA vaccine, of Pfizer and Moderna, to support our vaccine rollout plan, we will monitor and review the evidence before deciding how the AstraZeneca vaccine will be deployed in our province. I would like to note that only the mRNA vaccine, the Pfizer and Moderna products, are being used at this time at all our public clinics across the province. And it is important to attend your appointment, and I think Marion will speak to that as well. We are continuing to target vaccine to certain groups, as identified by the National Advisory Committee on Immunization, and our goal is to protect those who are most vulnerable and susceptible to severe outcomes, including hospitalization. We are committed to immunizing individuals safely and rapidly as vaccine supply increases. We are continuing our slow and steady march, we keep mentioning, to vaccinate Islanders. This week, individuals aged 65 to 69 can book their appointments, as well as those over the age of 60 with underlying medical conditions. That includes organ transplant recipients, certain types of cancer, cystic fibrosis, dialysis, COPD, people on immunosuppressive medications, individuals with developmental disabilities, including Down syndrome. Marion will speak about when the booking will start for those aged 60 to 64. In collaboration with Health P.E.I., we'll soon be releasing a schedule to let all Islanders know when they will be able to book their vaccine appointments between now and the beginning of May. Thank you to the many Health P.E.I. staff and other partners who are responsible for scheduling and administering COVID-19 vaccine to Islanders. This vaccine rollout is complex, requiring detailed planning, coordination, and cooperation on many fronts. People have worked tirelessly to ensure that Islanders have access to COVID-19 vaccines, and a sincere thank you to everyone involved. And also thank you to Islanders who have come forward to be immunized against COVID-19. Every person who's vaccinated helps the entire population. And I know there's been lots of discussion about the Atlantic bubble, and certainly we are planning to reopen the bubble, and that will be a decision for the premiers by April 19th, provided the COVID-19 case counts remain low in the region and outbreaks are contained. We will continue to monitor the number of cases in the region, including unlinked cases and outbreaks. The prevalence of cases related to variants of concern will be a key factor, along with any geographical spread of cases between provinces. Similar to last year, when the Atlantic bubble reopens, residents living in other Atlantic provinces will be required to complete a declaration form prior to traveling to P.E.I. Island residents who travel within the bubble will not be required to submit a declaration when returning home. But again, like last year, P.E.I. residents will undergo a general COVID screening at the point of entry and will need to show identification. Planning is underway to manage increased traffic in Borden, as we expect an increase in vehicles arriving in P.E.I. when the bubble reopens. The pandemic has been especially challenging for individuals living in long-term and community care facilities and their families. They have missed regular recreational and social activities, and visitation with loved ones has been limited. So contingent on the fact that we do not have community transmission, and in recognition of the high rates of immunization in long-term care and community care facilities among the residents, The following measures will be eased effective April 1st. Designated visitors can visit in designated areas or in the residence room, and residents can attend church services in a community setting in the company of a partner in care or designated visitor following the specific guidance. And long-term care and community care facilities can resume church services for residents and partners in care following the worship service guidance available on the website. And as I mentioned, these changes are contingent upon P.E.I. having low COVID-19 case counts with no widespread community transmission of the virus. Currently, registered rotational workers are being vaccinated against COVID-19. Any registered workers who have not been contacted with an appointment should call 1-844-975-3303 to book a time to be vaccinated. These rotational workers can expect to receive information directly regarding some adjustments to their isolation requirements after they are immunized. These modifications will be effective 21 days after they are vaccinated and will be supplemented with a rigorous testing regimen. Going forward, vaccinated rotational workers who choose not to follow the testing schedule may have their rotational worker status revoked. This week is a special and sacred time for Christians, being Holy Week, and the past year has been a difficult one for most churches. Services have moved to online platforms, congregations are smaller in keeping with the organized gathering limits, the ability to gather and socialize as a community has been hampered, and fundraising and weekly collections have been impacted by COVID-19. So thank you to all clergy, staff, volunteers, elders, and leaders in the churches across P.E.I. for your patience and continued support of the COVID-19 measures over the past year. I can't believe that this is the second year I'll be saying this, but I know many children are wondering if the Easter Bunny will be able to visit this year. And like last year, the Easter Bunny is immune to COVID-19, and as such, he will be able to visit children in P.E.I. The bunny is very organized and has already applied for pre-travel approval and is being exempt from self-isolation. The pandemic will not keep the Easter Bunny away. As we celebrate the Easter season, we have much to be grateful for. To date, as we mentioned earlier, we have managed everything that COVID-19 has given us. We will have enough vaccine to immunize all eligible islanders with 1 dose of vaccine by the end of June and 2 doses by the fall. To date, we've not had any hospitalizations or deaths due to COVID-19. And to date, our loved ones in long-term and community care have been spared the devastating impacts of facility outbreaks. Our children have benefited from in-class learning since September, and we have more of the pandemic behind us than ahead of us. We can see the marathon finish line off in the distance, and as we continue our journey with COVID-19, we are reminded of the basics. I don't think I need to repeat them about keeping our circle of contact small, the physical distancing, washing our hands. But, so as many are looking forward to celebrating Easter, please keep our gatherings small and respect the public health measures, including that physical distancing. And as we started, please look out for each other and be patient and be kind. Thank you. Turn it over to Marion.
Thank you, Dr. Morrison. Good morning, everyone. The large vaccination clinics Health P.E.I. is running in our communities continue to immunize more islanders this week. I do want to reiterate our Health P.E.I. clinics are only offering the Pfizer and Moderna vaccines, which are safe and effective. Please come to your appointments if you have booked them. Patients who are scheduled to receive COVID-19 vaccines at these clinics are reminded that the clinic locations, both in Charlottetown and Summerside only, have changed. However, your appointment time does not change. Those who have an appointment in Charlottetown are now advised to go to the Eastlink Center, the Trade Center entrance. There's no longer a clinic at the Sherwood Business Center. Those who have an appointment in Summerside are advised to go to the Holland College Waterfront campus, as there's no longer a clinic at the County Fair Mall. The location of vaccine clinics in our other communities, O'Leary, Montague, and Surrey, have not changed. I would also like to just be clear that vaccine clinics have varying hours, and your appointments may take place in the morning, afternoon, or early evening. The appointment time given to you through our online booking system or over the phone is accurate, and please come at that time. There are drop-off zones for anyone who has accessibility challenges at each of our clinics, and signage is in place, as well as volunteers to guide the public into these clinics. This week, we continue to book individuals aged 60 to 69 or older with specific underlying medical conditions and their primary caregiver. Those specific medical conditions, some of which Dr. Morrison mentioned, are outlined on the P.E.I. government website. We also continue booking those aged 65 to 69 years old, and since yesterday, those in that age group were booked if you were born within the months of January to March. And starting today, individuals born in the months of April to June can make appointments. Tomorrow, individuals born in the months of July and September can make appointments. And starting Thursday, April 1st, individuals born in the months of October through December can make appointments. Next week, we will open further bookings to more Islanders. Beginning Monday, April 5th, Islanders aged 60 to 64 years of age can book their appointments, again broken down into 4 groups based on birth month. Beginning on Monday, April 5th, individuals born in the months of January through March can begin booking their appointments. On Tuesday, April 6th, individuals born in the months of April through June. And beginning Wednesday, April 7th, individuals born in the months of through July to September, if you're age 60 to 64, and on Thursday, April 8th, individuals born in the months of October through December, age 60 to 64, are able to book your appointments. Appointments can be made directly using our online booking system at princeedwardisland.ca/getthevaccine. And this is the quickest way to book your appointment, and it's very easy to use. I will note for those booking online within that age cohort that's currently being called, if you have a spouse or partner in your household, you can book both appointments online at the same time and not wait till the Thursday if your spouse was born later in the year, so that you can have your appointment times close together from the same household. Those who cannot book online can call our 1-844-975-3303 booking line to speak to a booking clerk. As Dr. Morrison mentioned as well, this upcoming weekend is a long holiday weekend for many on the island, and I want to remind people that we did have clinics booked on Good Friday, and we have rescheduled those to Saturday, April 3rd, as no vaccine clinics are going to be open on Good Friday. Your appointment reminder will indicate the new date. It's just one day later. And also note that the vaccine booking phone line is closed on both Good Friday and Easter Sunday. The vaccine booking line will be open on Easter Monday. As well, our COVID-19 testing clinics have some reduced hours for this Easter weekend. Both the O'Leary and Montague testing clinics are closed on Good Friday, April 2nd, and Easter Monday, April 5th. The Summerside, Slemon Park, and Charlottetown Park Street locations are also closed on Good Friday only, April 2nd, but they are open on Monday, which is Easter Monday. This information will be available on our website and provided to the media as well, so that those hours can be clear to the public. Thank you once again. I hope everyone can enjoy their upcoming holiday weekend and celebrate with those close to you, while continuing to keep your circle small and following the public health guidance to reduce the risk of spread for COVID-19. Thank you.
Thank you, Marion. And we'll open it up for questions.
Dave Stewart, the Garden.
Good morning. I think my first question, pardon me, is probably more of a clarification, or I'm just trying to make sure I have it right. In terms of the AstraZeneca, and again, a follow-up, I believe, Dr. Morrison, you answered much of it there in your presser yesterday afternoon. Nobody in the province, as I believe I heard you say, is being given the AstraZeneca right now. So anyone who has appointments immediately, booked appointments, those appointments are going ahead as scheduled, and they will be receiving either the Pfizer or the Moderna?
That's correct, because the only clinics, the only places that the AstraZeneca was being administered were through the 6 pharmacies. We only had a small amount of the AstraZeneca, so that's how it was being distributed. So right now, all the clinics across the province are only using the Pfizer or Moderna mRNA vaccines.
Okay, and a follow-up, I guess, would be we've been told it relates to the Provincial Correctional Centre. We've been told that someone who is not an inmate or an employee at the jail received the vaccine. So I guess the question would be, what checks and balances are in place to ensure that the people targeted for the vaccine are getting the vaccine?
I mean, I guess maybe I'll start and let you continue, Marion. So certainly the staff at corrections, as well as others who are involved at the Provincial Correctional Facility, I know are being vaccinated, and also those who may be interacting closely with those at the correctional facility are being certainly given a targeted as well to make sure that we are trying to vaccinate the people who may be having close interactions, and that might include, for instance, sheriffs. For instance, that would be one group. So that would be my general comment. But if it was about someone getting vaccine more generally in a different setting, I'm not sure. Marion, you might want to comment. I don't know if.
Yeah, I don't have any details on how that would have occurred, but maybe we can answer some specific questions afterwards if you have them. But really, it is through those staff involved with our correctional facilities, both the youth and the adult population. So I guess I'd need a little bit of information about the situation to understand why something like that may have occurred. Of course, we have been all along in any of the specific rollouts ensuring that every single dose is used. And as we know, there are doses in each vial, and depending on the clinic numbers, we may have a single or 1 or 2 doses available at the end of a clinic day, depending on who comes and the dose is counted. So that's some of the logistical challenges Dr. Morrison mentioned about creating these clinics and having appointments and managing all of those pieces. But yeah, I guess I'd need more information to kind of speak to the specific situation.
Great, thank you both.
Welcome.
Brian Higgins, CBC.
Yes, hi. Given the third wave that's now underway in the rest of Canada, and the fact that young people are getting COVID in large numbers, my question is, will the 18 to 29-year-olds here on P.E.I. now be getting Pfizer and Moderna vaccines since the AstraZeneca is on pause?
Hi, Brian. So we, and I think I may have tried to mention it yesterday, but I'm glad you asked again. So in general, what we have been trying to do is follow the NACI sequencing for populations in terms of the vaccine rollout, which is primarily age-based, or looking at those who are at risk of severe outcomes of disease, are most vulnerable. So, and also depending on the settings in which they live and work. So I think it'll be important that we continue to follow that primarily. We know that it certainly has been those, and the biggest percentage of people who've ended up in hospital or dying have been those who've been 60 years of age and older in this country, and that's we now have close to 1 million cases that we have been able to look at for that evidence. And so we are going to be making decisions, and I think I mentioned looking at the evidence and that's coming out about AstraZeneca, about how we will use any additional AstraZeneca that may come to Prince Edward Island. But at this point in time, we've not made any decisions about changing population groups around, and that guidance would come nationally. Many of the people we were doing are frontline essential workers, and we definitely have a category for many frontline essential workers, so that will be one of the other groups we will be looking at.
Okay, thank you. And today you asked people to show up for their appointments. I'm wondering if you have seen cancellations or no-shows in the past 24 hours because of the AstraZeneca situation?
Yeah, Brian, I can speak a little bit to that. We have heard from some individuals who had appointments booked today calling to cancel with some concerns over the vaccine. So we just want to be really clear that people understand our clinics are only offering the Pfizer or the Moderna, the mRNA vaccines, and they are very safe, and there is no concerns with people coming. So we have received some people calling today to cancel their appointments at some of our clinics that were happening today. It's a small number that I'm aware of right now, but we just want to reassure people that there are different vaccines that we are offering at those clinics, and to please come and attend your appointments, because we know they've been anxiously awaiting this time when they could receive the vaccine.
Thank you.
You're welcome.
Brian, I'll just add that I think, and I may not have given the numbers earlier, but we have 21,712 doses of vaccine that have all been administered to Islanders, and out of the 21,700 doses, 1,680 of them are AstraZeneca, but all the rest are Pfizer and Moderna.
Okay.
Carrie Campbell, CBC.
Thank you both. I just want to ask, first of all, I don't know if you can provide an update on how the vaccination program is going for healthcare workers. We've just sort of anecdotally heard from a couple people. I think they're both nurses working in the hospital. I know one is at the QEH, and they said they hadn't been vaccinated yet. They didn't know when that was happening, and there were concerns just based around where they work and the vulnerability of many of the patients that they care for.
Yeah, hi, Carrie. I can speak to that. We have been rolling out and awaiting additional vaccine, and that has arrived. So over the next couple of weeks, we will be contacting even more of the frontline healthcare workers who are not in our COVID-specific areas or involved specifically in the response or in our emergency departments that were outlined early on in the vaccine rollout. So they will be receiving their vaccine and their calls for appointments in the coming weeks and very soon. So as soon as we have enough doses to do that call out, those individuals, if they're frontline nursing staff or other frontline clinical staff and support staff in the patient care areas, will be next to be arranged to have their appointments. So that has been ongoing over the past week and continuing on for the next week. And of course, we'll also be looking ahead to those other private home care providers, other private health care providers in our communities as well, which we are looking forward to being able to call and book them for their vaccine appointments as well.
And I just wondered, Dr. Morrison, maybe you could speak to just how, I'm surprised that we're, some of the other vaccinations that are going forward while we're still trying to get all healthcare workers vaccinated. Can you just talk about maybe how this has been prioritized?
Maybe I can just add something, Carrie. Maybe first is that it's important to know right now we're calling out for booking of appointments. So we still continue to vaccinate based on our doses that are allocated. So the people in our community clinics receiving vaccine appointments now may still be those individuals who are early on prioritized and booked, because those are the doses of vaccine we have. So those individuals aged 80 and above are still receiving their first vaccines as well at this point in time. But we're trying to get people booked into appointments as quickly as possible. And as our appointments ramp up based on the doses that arrive, we'll be doing more groups concurrently and at the same time. And so those healthcare workers are a very important part of that as well. And we've figured out some other processes to not take away from our community clinics, but also prioritize those group of healthcare workers and provide some immunizations to them either at their workplace or at other locations.
All right. Did I use up both my questions? If I get one more, I'll just throw this out. I wonder, I know we've got a certain number of AstraZeneca doses, and I think we're scheduled to get more in the coming week. So what's the shelf life on those, and what do we do with those? I guess we hold on to those and wait, but...
Hi, Carrie. So the approximately 300 doses of AstraZeneca that we have remaining in the province they have a shelf life until early June. And so that we will be able to certainly take some time to make sure that we figure out exactly who we might want to offer us those vaccines to. The next shipment that's coming in, we have one shipment that's expected in another week or so of 6,000 doses approximately. And again, it has a shelf life that will be for at least a month, if not longer. And so we will again have some time to look at the evidence and make some decisions.
Okay, thank you both.
Thank you.
Gabrielle Drummond, Radio-Canada.
Good afternoon to you both. Ma question, c'est en français, bien évidemment, pour la docteure Edda Morrison. Bon, docteur Morrison, si l'administration du vaccin d'AstraZeneca reste suspendue au-delà de l'intervalle qu'on donne de 16 semaines entre les deux doses, est-ce que les jeunes qui ont reçu la première dose vont recevoir un autre type de vaccin lors de la deuxième dose? Est-ce qu'il y aurait cette possibilité ou c'est pas possible?
Bonjour Gabrielle. Alors, on est en train d'en discuter et puis on va recevoir un peu d'informations de l'information nationale vraiment. On sait qu'il y en a les études en Angleterre et autre part qui regardent si c'est effectif d'avoir le AstraZeneca et puis suivi d'un autre mRNA vaccin. Et puis, ils sont vraiment les mix and match, les études qui font mix and match. Mais on va regarder s'il y en a l'information à propos de ça. Alors, j'espère faire une décision dans les semaines qui suivent avant, bien sûr, qu'on doit avoir leur deuxième vaccin.
Tout à fait. Et juste pour continuer dans les études scientifiques, on sait que les femmes présentent un risque plus élevé de développer des caillots sanguins quand elles reçoivent ce vaccin d'AstraZeneca. Est-ce que vous avez pensé peut-être de réserver les prochains lots de vaccins d'AstraZeneca seulement pour les hommes?
C'était, je pense, discuté, mais ils sont en train de regarder l'information et puis même la compagnie de AstraZeneca va donner l'information aussi au Santé Canada pour regarder même plus en détail l'information et l'évidence à propos des femmes, les hommes, les âges. Et alors, on va suivre. À ce moment, Nancy dit c'est moins de 55 ans qu'on va faire une pause et puis on peut faire une distinction entre les hommes et les femmes. Alors, on va attendre pour une autre direction.
Okay. Merci beaucoup. Bonne journée.
Bonne journée.
Laurent Rigaud, La Voix.
Good afternoon to you both. Docteur Morrison, j'ai une question sur la bulle. Est-ce que vous pouvez nous réexpliquer en français, s'il vous plaît, ce que vous avez dit au sujet d'un formulaire qui sera à remplir par les gens du Nouveau-Brunswick, de la Nouvelle-Écosse ou de Terre-Neuve-et-Labrador qui voudront venir à l'île? C'est pour faire quoi, ce formulaire?
Bonjour, c'est vraiment la même que l'été passé, qu'on avait la boule. Et puis les résidents de Nouveau-Brunswick, Nouvelle-Écosse, Terre-Neuve et Labrador, quand ils sont en train d'arriver à l'île du Prince-Édouard, ils doivent avoir rempli en avance, on s'appelle ça en anglais, c'est une forme de déclaration et puis vous répondez à des questions et puis faut signer et puis présenter ça quand vous arrivez à l'île du Prince-Édouard. Il faut aussi avoir des questions, mais pour les résidents de l'île du Prince-Édouard, les insulaires, s'ils sont Nouveau-Brunswick ou Nouvelle-Écosse, quand ils retournent à l'île du Prince-Édouard, ils ne doivent pas remplir ce forme, mais ils doivent présenter leur identification et de répondre aux questions au point d'entrée. Alors, même sorte de chose qui est arrivée l'année passée, pendant, je pense que c'était 5 mois qu'on avait la boule. Et puis, on était en train vraiment d'organiser parce qu'on anticipe avoir beaucoup plus de trafic le mi-avril, si tout va bien.
Merci. Et toujours au sujet de cette bulle, aujourd'hui on parle de l'Atlantique. On ne sait pas s'il y aura un jour une bulle canadienne cet été, mais il y a 2 endroits, Saint-Pierre-et-Miquelon et les îles de la Madeleine, où la vaccination va très très vite et les gens seront vaccinés très vite là-bas. Est-ce qu'il y a des discussions pour les inclure à la bulle atlantique ou c'est hors de question pour le moment?
On n'a pas vraiment discuté. Je sais qu'on a les gens qui voyagent plutôt entre les îles de la Madeleine et l'île du Prince-Édouard que Saint-Pierre-de-Miquelon, mais alors j'ai pas eu ces discussions à ce moment. Je sais qu'on sont vraiment en train de vacciner les insulaires. On habite ici sur cette île, dans cette communauté, et puis on doit faire notre mieux de nous protéger ici le plus vite que possible. Alors, on n'a pas eu ces discussions à ce moment encore.
Merci beaucoup.
Okay, merci. I think that might be it. So thank you very much and have a good week.